So, warm good morning to one and all present here. And the topic for my today's session, it will be on applications of AI in life sciences. So, I would like to have a detailed introduction or an overview about the process of artificial intelligence and its related technologies initially, and then further move on to the various applications of life sciences. So when we call it as life sciences, and it connects with various departments such as biotechnology, bioinformatics, chemistry, zoology, botany, and all other departments, pharmaceutical, medical, and all these domains has a lot of potential applications where it can be transformed into artificial intelligence or automation can be carried out, particularly in sectors of healthcare and other relevant areas. So that will be the presentation for the next 1 hour or 1.5 hours, what it will be. So myself currently I'm associate professor in Department of Computer Applications, Bharatiyar University, Coimbatore. And I have 15 plus years of experience in both teaching as well as in research. And since I've got into an application time, this will be the session outline. So we could not directly jump into artificial intelligence because we have an stack that has to be moved upon to make automation. So automation could not be done immediately. Automation is not possible to be carried out immediately. That could not be done immediately. Automation again, it takes its own phases. So there is a technical stack that has to be followed for automation. So this is what is the overview of the slides that will be presented during the next session. So whenever we talk about artificial intelligence, then we could not leave out something called as data science. So data science, it is one area or an umbrella which covers everything. So let me give an introduction about what is data science processes, and hope the other relevant areas, data analytics, and how do we collect data and what do we do and all those things, and then get into the use cases directly. So when we look on with data science, so when we normally these words are nowadays becoming more familiar, and it has become a technology words, hot technologies that is being going to get implemented. So one such common word which has that is being regularly used in all domains as well industries as well as academia is one. It is data science. So we have seen that a lot of new courses has been coming out, a lot of open online MOOC platforms, they do offer courses in data science. So let us understand what is data science initially, then we'll move on to healthcare. So data science is nothing but it is a domain, it is an umbrella which is used, which groups various other other areas. So which acts as an umbrella for relating multiple computer related disciplines into one group. So this is what is a data science, and this data science process has to be carried out into a full stack so that automation can take place. So when we want to do into an automation, it requires the process to go along further steps. So it requires something, and data science, it is again a domain which is going to connect all these areas together. So this is what it is going to be the purpose of data science. So when we call it as data science, and data science, it is a multidisciplinary domain, or it has multiple domains and branches that has to be collaborated together to solve a particular research kind of problem or a particular solution for the benefit of the society. So, or for the business. So this is how it goes. So when we talk about multiple disciplines that are being connected with data science, then the disciplines are as a whole, when we look onto the technical part, then we have a core inner technical layer of multiple disciplines such as under computer science also, we do have specialized areas such as databases, data visualization, data analytics. Then we do have either machine learning, which I've left out. Then we have an artificial intelligence, AI, which comes in. So AI becomes a core inner layer. AI becomes a core inner layer. And among those inner layers, we have the other related fields. So when you want to make artificial intelligence, then AI becomes the outer layer, which is to transform the reasoning and intelligence. So to do that, we have a data analytics layer, then we have a machine learning layer, then we have so many other layers. To do a machine learning, we do have statistics, we require mathematical concepts, and we require databases also to be related into this domain space. Now, as a whole, data science is multidisciplinary. But again, right, so it is all computing in nature. It is all computing in nature. Now, the current scenario, the transformation of these technologies of data science and its related disciplines, and I have left out one thing, it is IoT. These disciplines has to be implemented for the betterment, solving society issues, or else not solving the research issues. So it has to be imported to, or it has to be integrated with the domain knowledge of other domains. So for example, when we talk about life sciences, then there are number of problems or domains that are being related with life sciences. So when we have life sciences, we have solutions from life sciences related to biotechnology, from bioinformatics, botany, zoology, chemistry, physics. Every years and every domains has a contribution. So data science process as a whole, what it does is it gives a continuous pipeline of connecting all these things, of how to make a pipeline in gathering the information so that an automation can be carried out. So the first and foremost thing, so let it be a business kind of scenario, or it can be a research kind of scenario. Because now data science has been implemented by all business organizations, since we are transforming into a new industry revolution called as Industry 4.0. So now we are slowly transforming into Industry 4.0, so which is going to be a digital era, and where all the areas, manufacturing, academic, education, marine, chemicals, all the areas of the industries has to transform or expected to transform or to get into the new era of Industry 4.0. So Industry 4.0, since we need a digital transformation, so these technologies pitch into this specific space of related to data science and its other related areas. And this is expected to happen in the year 2030. So this has been expected to happen in the year 2030. So when it is expected to happen in the year 2030, so in an academic perspective, they require upskilling of these technological skills to the graduates so that they get the opportunities. So this is where again academia is transforming from based on Industry 4.0 to Education 4.0. So where we talk about these technologies of integrating these technologies into various domains. So I want to make it clear where data science comes in and how data science makes it picture. Now, when we get into a data science space, when we want to integrate all other issues and researches into this data science specific platform, then we require to follow this pipeline, or we require to do a processed flow of gathering the information in a specific pipeline. So which requires, the first thing is requires a business understanding. So which requires the understanding of the domain what we are working. So the domain may be a life science domain, or it can be a commerce domain, or whatever might be the domain. So it requires a very clear understanding of the domain what we are working, so that it becomes very, very important to be addressed. Once the domain understanding has been happened, the second part what we going to witness. So how do we converge, or how do we transform the domain requirements or the solutions to arrive a solution for an automation or a problem? So we need an analytical approach, so which requires again three important phases of data requirement gathering, data collection, data understanding, and data preparation. So when we call as these pipelines as data requirement, data collection, data understanding, and data preparation, So there it connects the domains of statistics, it connects the domains of computer science, more on computer science, and computer data analytics. It connects the domains of data analytics. It combines it in the domains of text analytics. It combines the domains of linguistics. It combines the other areas also, because the gathering of data vary from one domain to domain, and it varies from the methodology of extracting data also. It varies from one specific problem to other problem. And in order to do that, since we have to do with Splendid, collect large volume of data, it can be done for a large volume or it can be a small volume of data. So that's it. So it requires requirement analysis, then collection of data, validating the data, verifying the data, and finding out what is its insights, how the data has been associated, how it is being correlated, and all those things. So we use these technologies. Data analytics plays a very important role into it. Statistics comes into picture, ML comes into picture, and all these areas are integrated. Once that particular phase has been ready, then we move on to a model called as machine learning. So data preparation is a phase where we try to put the required data, about filter out the required information and features and make the data ready for a modeling part, so where ML model comes in. So whenever we talk about artificial intelligence, we have to understand that we want our computers, our machines to take decisions by itself as like human. And how do we make the machine to take a decision, and the machine could not take a decision by itself? So the machines has to be trained with different kind of scenarios so that it learns something by itself. And when it came across a kind of scenario, so that it can come out with a specific decision based on its learning by matching different kind of patterns or matching different kind of scenarios, and it gives an output. So in this case, it requires two things. One, it is making the machine to understand what has happened in the past. And the second thing it is, how do I make my machine to understand and take a decision like individual? So the expertise of individuals has to be blended into the data knowledge, and the data, what is being generated by the different models, like from databases, from business processes, from social medias and anything else, whatnot else. We can include everything. So that has to be prepared, and that preparation has to be taken to the modeling phase. And when we call on as modeling phase, modeling, it is nothing but it's going to be a machine learning model or deep learning models. So this modeling phase, it converts or it extracts pattern, which is going to train the machine to learn. So this is what happens in ML process and deep learning process. Once that part it has been over, then that has to be evaluated, feedback, verified, because one thing, so I could not make one single algorithm, run my algorithm with data and say that my machine has learned everything. That could not be done. So machine has to be trained with different kind of scenarios, with rich experience scenarios and data, so that the machine learn. Once this phase is completed, then we get on into the automation, artificial intelligence. Again, to automate it, we have to create something called as a knowledge base. Now, what is a knowledge basis? Now I have to train my machine to think like human and make the association of the knowledge what we have in associating and pulling into the data, so to make an automated decision. So this requires a data science pipeline as a whole. So this has to be done. Once this part it is being carried out, then we get on to the first phase of understanding the data analytic parts. Because in the first phase of data science, we have data extraction, data gathering, information extraction, and all those things. So what do I do? So here I pitch in a domain called as data analytics. So now the question will be in the other form, whether I will use data analytics only for commerce or is only for computer science. Not. Even in life sciences, data analytics plays a very important role. For example, I would like to make a simple use case over here, not going in a very detailed use case. No. And when we look on with life sciences, we have, I'll talk with respect to bioinformatics data sets, because we have lot of microarray data sets that are being generated to study the expression level of genes that are being happening expressed for specific kind of disorders or for specific experimental study of relating with different kind of diseases and its pathways. So this is what bioinformatics is. So a microarray bioinformatics is a study of computing and information technology where genetic genomics data it has been maintained, proteomics data it has been maintained, and the pathway related to genomics and proteomics is being maintained, and all these things is being maintained. Now, when I want to find out, or when we are trying to analyze the genes which cause us oncology, a specific type of cancer. So when we try to analyze that, genetical information is being required, or genomic data has to be collected, genomic data has to be verified, genomic data has to be validated. Only when we try to do this part, collection of data, gathering of data, requirement of data, analysis of data. So when we want to do this particular phase, and this requires a data analytics pipeline to be carried out. And when I say this was my problem as a use case, so I want to collect the gene, analyze the gene expression profiles that leads to a specific cause of cancer. So when this becomes my abstract objective of my use case scenario, so in order to do that, a specific type of cancer, so let me say that a specific type of cancer may be a lung cancer or an ovarian cancer or whatever it is. So in this case, so we require data not only from gene expression profiles, we require data from the previous literatures where authors has listed out or carried out their experiment and share their knowledge available in the literature database. So when we talk about life sciences and bioinformatics, there are good number of scientific literatures related to genetic gene expression profiles and scientific studies available in PubMed, which has millions of literature documents, which is an open source document. So I have to collect the literatures. Only when I collect the literatures, I can find out what expression profiles the other people have used and what should I go on and how do I associate and what will I find out. So we require to gather it. And when I say that there are thousands of literatures available in that particular literature database, curating or pulling out the data manually becomes infeasible. And herein we bring into text analytic phases of gathering the required data, making the data available, so that we do in text analytics, we do a text-based data, we do it, and from the text-based data, what we've collected, we try to find out the gene expression profile names that has been used by various kind of literatures, and we do it. So this is one phase. And second part is I do collect gene expression profiles. So all of you know that gene expression profile data, it has your gene names and it has the expression level of genes under different experimental conditions. So normally there are different kinds of microarrays that has been used to record the genetic information of patients. So this is where, and the gene may be expressed at different levels. So when I want to take, so there will be hardly 3,500 genes, 4,500 genes that may be causing or maybe related for a specific alignment or a specific genetic mutation to occur for cause of a specific cancer, for causing a specific mutation in the gene which may lead to cancer. So there will not be one single gene. So different experiments would have used different kind of genes on this specific scenario. So we may have 4,000 genes. Now when we look on with this 4,000 genes, so how do I make up the crisp genes which causes the genetic mutation, which may causes or induces the mutation causing a cancer? Because the gene inducing the mutation which causes cancer, it has to be identified, because then only then the pharmacologists and for the pharmaceutical industry can try to come out with a drug to treat that specific mutation. So this is how it will be related. So when I want to find out, when I have n number of genes, 10,000 genes, 20,000 genes, then data analytics has to be carried out. So in data analytics, what we do, we have to identify which gene is very highly significant, which gene contributes mostly, or what is the gene. In order to study it, we have to rely on data analytics. And when we say data analytics as a whole structure, as a whole process, Then it consists of the four areas: descriptive analytics, diagnostic analytics, predictive analytics, and prescriptive analytics. Any part of data analytic phase of data science phase, we have to go along with descriptive analytics as well as diagnostic analytics to understand what has happened, what has been available, and how it has been happened. And when we come back to genetic expression profiles, among the significant genes, we have to identify the among the listed genes, we have to identify the significant genes. Now, how do we identify the significant genes? We could not choose any 10 genes, we could not choose any 50 genes and come out with it. So again, we do have a different kind of researching. So what normally we do is we rely on statistical measures to find out the significance of tests. So we do have different kind of statistical measures available. So we have p-test, we have t-test, we have different kind of tests based on the hypothesis. And we may relate the genetic expression of a particular gene due to environmental condition, expression of a specific kind of gene due to other factors, expression of specific kind of gene due to heredity factors. So we may have different conditions and scenarios. So finding of the significant genes in different kind of scenarios, there we use data analytics mechanism. We use descriptive analytics. We use different kind of, we need visualization to visualize how the gene is being related, whether it's been upregulated or downregulated or undone. And again, we do a biological validation. We try to find out whether the gene exists in the pathway of causing a specific mutation, because all the genes may not take part in the pathway of causing a mutation. Some gene may leave even at an early stage. So pathway analysis has to be carried out. Then pathway analysis, if it is completed, then we have to check on with the gene ontology. This gene is highly, where it participates, which process it participates, right? So at cellular level or molecular level, it has something, or at biological level. So metabolic activity, this gene is highly predominant, or this gene is more predominant during a molecular activity or at a cellular activity. A biological validation happens. So for a life science studies, I'm trying to give a use case with specific to bioinformatics, so where these kind of things will be happen. So once I do with all these things, gather the knowledge, then we try to put into the machine learning model. And now my machine learning model, what it does is it tries to map it to a model so that it automatically identifies a pattern, it automatically identifies the significance or the variation of the factors that has been exhibited in the gene expression profile based on its values. So we require an ML model. And when I go for an image-based recognition, for example, and another kind of research, and I do have some different kind of use cases, I think I can say. So we go in for computer vision-based problems or deep learning models. And now in another scenario, now we are into an IoT arena. We are stepping into a new technology transformation of connecting all of the physical system into the digital space. So earlier we were only connected to the digital gadgets, digital computing environment, laptop to laptop, mobile to laptop, and communication. Now we want our smartwatch. Now you can see that most people wear their smartwatches, right? So which detects heartbeat, which detects so many things, right? So which can be done with a small device. So this data, then it can be transformed into a required platform. Then that data about the particular patient, about the biological vital parameters for healthcare, old age care, for critical care or something, can be transformed into the physician, right, who looks on, or the clinician who looks on with the changes that happens. So again, another technology is going to come into space. So which requires these phases. Once the ML model is being set, then we get into artificial intelligence for automation. Again, to automate this knowledge that has been received from machine learning, we need a different kind of technical stack. So this is how automation can be attained. Or immediately we could not automate anything when we look on with great, larger, complex problems. That is what I would like to convey at this particular point of time. And how do I explore data? Where do I collect data, right? So when we collect data, we collect most of the data we collect it from not for life sciences, since we have wearable devices to come in. So the data sources, most of the data sources as far as data era is concerned, 90% of data that are being generated only by individuals. And only 10% of data is generated by the business processes and business transactions, which happens with the database. And these are the different data sources which we collect information. I'm just not going to talk much about these slides, because when I talk with social sciences, then I do have a different use case. Since it's a life science study, I'm just skipping over these slides and just moving into big data application for healthcare for COVID pandemic. So what was the idea is, this was AI space for a microarray data. Now, what can be automated in AI healthcare? And this COVID pandemic has made that the technology can play a very essential role in managing pandemics, providing assistance to healthcare professionals working at various stages. And people have worked out with lot of things. And this technology has worked out in pharmaceutical industry to large scale, and we know that for mapping of people, identifying people, managing the governance, all these things, technology played a very much pivotal role. So where and how healthcare data can be related will be my next presentation. And when I say this life sciences or healthcare big data sources, I take into healthcare big data sources. So when I take it as a healthcare big data sources, then we know that this pandemic has made us so many new healthcare terminologies to be very common to know for layman also, which were very, very research oriented, because the term clinical trial was highly been used by researchers and the clinicians and the life science people who work on medical care and pharmaceuticals and drugs and so many things. But this clinical trial has now, this word has become very, very common word, that it has been used by everybody, or it has been everyone. So when I talk about healthcare big data sources, so one type of data related to healthcare, what we get it is from the hospitals. So we collect data from hospitals. Hospitals collects the databases and collects information from us. So we call those data as electronic healthcare records. Who provides data? Once these data it is being got in, the healthcare data it has been got in, where the clinicians will do a different, physicians will do a different kind of diagnostics, and different kind of diagnostics tools are being used, biochemical report, a chemist report, a microbiological report, a pathology study, different kind of studies is being done at clinician space. So they generate more large volume of data. Now, these data, it becomes very much pivotal and very much important, which has to be directly flowed into another relevant related area of healthcare, which is nothing but the R&Ds, research and analysis laboratories, who try to validate the data, verify how it is, and pharmaceutical industries, because they come out with the drug, the research and laboratories and pharmas, they come out with a different kind of drug. And when they want to do a different kind of drug, they need the clinical data, the outcome of the specific disease, their interaction and all those things. And this again, it requires data that has been collected with respect to medical literature, genetic study, proteomic study, because we now have a lot of biomarkers that has been come into, where a kit is able to predict. We do have a COVID kit. So just a COVID kit is able to say that whether we are positive or negative. So we need to come out with biomarkers, right? So to test a specific gene by a specific fluid, again, it requires genomic data, it requires proteomic data. All these data will be taken by researchers and pharmaceutical industries to study the different kind of alignments or different kind of issues that are being validated or that are being given by the clinicians and by the physicians. So this, and apart from that, when we look on healthcare, see, we could not leave in another industry which works on it is the insurance industry. The payers who pays for it, where we do have insurance claim for healthcare data, we could not leave it out. That is a very large area, because there are diseases. Only in the current scenario, before a year or 2 years back, oncology, cancer has been covered under healthcare insurance. But still, being diabetes is going to be the life-threatening disorder, and where a country like India, we are being the capital of diabetes, we do not have any insurance claims or policies to get a claim from the healthcare, from the insurance providers, because the cost of diabetic drugs is very costly. Again, we do not have insurance for other kind of complex chronic ailments related to kidney and so many things. And there are still children with affected diabetes 1 who have to take care, who have to take up their medicine right from 3 years. So they have to stay, say, 5,000 insulin. So there are so many other NGOs who support all these things. So again, insurance is an area where this data has to be transformed for validating, for coming up new kind of policies, or making your insurance scheme flexible for the benefit of human. And when we look on in other things, so I take my clinical data, diagnostics has been given to researchers who finds out a drug. And again, to make a drug, we require a lot of other literature to be carried out. And finally, when we look on with COVID, this actually happened. The cycle actually happened. So when people has been initially affected with this COVID pandemic, people from physicians and clinicians, when they reported to the hospitals, they identified the symptoms, they identified the signs, they examined them. They took different kind of clinical tests to find out whether it is a normal fever or it's a typhoid-like or dengue or what symptoms. And all these data is being transformed to them, and they identified the cause of virus. They did a viral study about, and they tried to map it. It was similar to the SARS, which has happened. And people worked on the genetic level, gene level data of SARS, and they tried to downtrend to the animals and birds, which causes these specific disease. And there were so many things has been that the virus will be spread on surfaces. Was there? Then again, it was said that that doesn't never happen. So different clinical things has been evaluated. A lot of R&D has been done with respect to gene level. And pharma industry started to put with lot of their efforts. They use technological based intervention. Pharmacogenomics is an area where people use technology to find out the drugs, for getting out a drug. So we are able to come out with a drug. India is able to come out with a drug for treating COVID, Covaxin, right? Which is a very large achievement as far as we are concerned, within a very short span of time. So these data contributed a lot. Again, they require to study the adverse effect of people related to the Covaxin and other kind of drugs. And the drug that has been by India has been validated by other people who work in national level, global level. They validated the efficacy and efficiency of this drug is again being put forth. So now we understood that. And again, when we look on these drugs that have been initially tested for clinical trial patient, again, this is an area which has been normally left. Only the hospitals can feed in with the information to the pharma industries about when a new drug is being come, to whom the drug can be injected and tested. We could not go and test a drug to anybody else. When it has been injected and tested to the patients who are being affected, then the results of the drug or improving the efficiency of the drug may be improvised. So clinical trial was being carried out. It was being initially injected with the consent of the people. Even there were consent form when the drug was being initially given to, when we were being asked to take up with Covaxin or Covishield, there was a form that was being signed, right, to sign with the agreement stating that the adverse effect of the drugs will not cause or will not go anywhere for a lawsuit or not. So clinical trials were being done. So many things has been done, and this it comes in. So Covaxin or any symptoms with insurance, we had an insurance scheme. Again, we got into an R&D. Pharma has come out with the different kind of drugs. And when a new variant comes, people try to test the variant, their symptom, their pathway, where it affects. So earlier it was said with the pathway is being related to respiratory. Then it was being said to it is not respiratory. It is even related to cellular level transformation and so many things, right? The adverse effects as well as the benefit. It went on like this. So this is where we required and data science pipeline of integrating all these information. So when we want to automate something, in any of these areas, any of these areas. So for example, when I say automation, so now the information about the symptoms of the pandemic is being collected by all hospitals. Every hospital has this data of their choice. Now, when we want to find out, right, because when the first day, everybody were asked me to be an alert. After a period of time, they said that, see, the mortality rate of this COVID was very high. Only people who had some comorbidity, who were with diabetes, who were with different kind of alignments, it does not affected with other kind of people. So when to identify this association, people could not search, people could not do, because when India is concerned, all our data related to the people affected with COVID is available as far as government is now. Now, when they want to try it out to associate these comorbidity features, it could not be done manually. So we need an automated AI system to immediately filter it and take it and give it to the clinical trials, give it to the pharmaceutical industries, and pharmaceutical industries who have done all the studies, if they have an automatic information board to connect it with it and do an association and stuff, and this is where AI comes into picture. So for data curation, data extraction, data analytics, and all those things, it can be pipelined, it can be done. AI could not take away the human knowledge. AI could not beat human, but AI can be done to assist human in such a way that they can make the process very simple and light. So this is where artificial intelligence comes into picture. So when we look on with healthcare data sources, these are the areas. And there is another area where whenever we talk healthcare, we never think of that. It is distributor. So a drug has been got by, a vaccine has been created for COVID. Vaccine has been produced in plentiful, and the distribution of this drug, supply chain and logistics. See, now we think of management, supply chain, logistics to come into it, because distributing the data to the data warehouse and making the drug to be maintained in proper conditions, right? Proper condition without reaching its expiry date in a cool room temperature or something. So this again, it has to be connected with the healthcare data, because we have heard from newspapers that the wastage of the vaccines were at higher rate because it was all expired, because due to the lack of distribution, shipping of data, making the drug to reach the particular place. Now here IoT based devices comes into picture. So how do I track the vehicle which takes up the drugs? There were drones used to deliver the drugs. So how do we do it? So not only for COVID pandemic, any kind of thing. So we require these kind of people to get in. And when we look on these pipelines of fetching the information for solving any specific problem, then the healthcare data has to flow in all these multiple faceted disciplines. So which required expertise from statistics, because we have different kind of techniques. We need expertise from mathematician to come out with a good model or to help us to choose a good model, a computer professional. And again, we need social science people to say the emotional level. COVID has impacted a lot on emotions, right? Psychology and psychological emotions. So social sciences people also, this data will also be helpful to find out the impact of people with social sciences and psychology and so on. So this is where we call it as data science, and this is where we call it as big data or data analytics. So transforming data into big data analytics is there, and artificial intelligence will be at the topper layer, which helps us to find out a lot of things. And when I say the clinical data, I think I have just already been given very detailed, right? I do not know whether the slide was there. I didn't look onto that. So we have clinical data, physician order, EHR, physician's written notes, prescription, medical imaging, scans, and all those things. Pharmacy, genomic data, sequencing databases, and all those things. Machine-generated data for healthcare will be wearable gadgets. Data from equipments, different kind of equipments are being placed in hospitals, right? So the vital signs, measurements, automation of all those things, and social media also nowadays people have shared with a lot of information related to COVID, for sharing their emotions, sharing their stories, and coming up and coming back and revisiting and towards things. So all these becomes the healthcare big data sources, and in all these areas they required data science pipelines, and somewhere a data analytics pipeline, and somewhere at a higher level of artificial intelligence to take place. And when we look on with data science, again, this is where it used. There's in big data in life sciences. So for drug repurposing, identifying new biomarkers, identifying new drug targets, personalized healthcare, and identifying adverse event reduction, right? So what is the adverse effect of a particular drug that it is being taken up? So what is a study of all these things? Then we required analytics, which requires again when we downline. So we need data analytics, and again to identify the adverse event reduction, right? So we require an automated system, right? When people are being reported with a different kind of symptom, which is being normal symptom has been expected, right? So when we had Covishield or Covishield, we have said that we'll have a head pain, we'll have some kind of dizziness or some kind of fever or something. These are the normal symptoms. But some people, when they exhibit a different kind of symptoms, when it has been recorded as a whole, then we need an artificial intelligence system to report immediately to the clinical pharma companies, or pharma organizations, or pharmaceuticals to state that, right, what is the adverse event reduction of course as a whole. It's a global, because this pandemic has made us all connected globally, and the drugs it has been equally, it has been distributed globally, and it has lot many more. So this is one thing. And again, where it has been used, I have said that integration of these data, it requires from these major sources. So where we required AI-based techniques for integrating, for clinical decision support, for payers, for intelligent services, for providing matching to verify whether it has happened, and personalized medicine. So when we look on personalized medicine, it is not far away, but it may happen within a very few span of time, because nowadays we do have only trial and error medicine. If somebody could, suppose my physician, my doctor could prescribe me the exact medicine what I require based on my genetic profiles, genomic profiles, then that we call it to be personalized medicine. So this is where people are working towards something. So these are healthcare aggregators. And what else it is being used? Again, it has been used in the insurance sector. AI is being used to find fraud detection, risk management of population risk management. Again, social studies automatically pick chains. And when we talk about providers, evidence-based medicine, right? So is there any evidence-based? Again, there are so many studies. When we look on with the medicines, when we talk about life sciences and medicine, we have Ayurveda, we have Siddha, we have Unani, and there is Ayush, which supports all these things, right? So we had Kapasura Kodini. Right now, we need evidence-based medicines to be priced. So herbs, botany department comes in. And there were different kind of medicines. So zoology department comes in to identify the clinical trial to be injected on different kind of animals, right? So which animals have a different kind of sequencing mechanism. Zoology departments can pitch in, identifying different kind of herbs that are being caused. So for identifying evidence-based medicine related to Ayurveda, related to Siddha, all those things, it becomes very important. And the third one where it is used is managing the wellness of the patients, right? So normally one thing it is, see, after this COVID has caused with lot of symptoms for so many people, right? So post-COVID has created a lot of symptoms. So it has resulted in lot of stress, and there were being obesity, there are different kind of alignment, tiredness, and so many things. So how do we use for wellness of patients? How do we manage people provide with wellness when we have these kind of information that has been available? And as far as hospitals are concerned, let me again go back to COVID, because bed management become a very critical during the second wave of COVID, because everybody who are being initially being tested with the very basic mild symptoms and who were affordable to hospitals, we rushed to hospitals, occupied all the beds, and where actually the person who were risky, who were in need, could not get to that particular thing. So managing the wellness, managing those things, managing the hospital admission rate, again, we required a data science pipeline. We required an automated system to say that, see, this patient, I can have an AI system reading the symptoms, all the things. Now my system can guide me and say me, right, See, you have a normal COVID symptoms. You may be set right within this because your oxygen level is okay, your BP and all other your vital signs are okay. But this happened during second wave, and we know that so many of them were being on the roads for oxygen support without getting a bed, and this we have witnessed. Right? So wellness of people again is an area which may be related where artificial intelligence can be induced on it. And this I will be, and again, what is evidence-based medicine is personalized medicine. So we go for surgery normally when we go for tooth, right? Dentist gives us three choices for replacement of our cap. So when we go in for your tooth dentist, so he gives us different kind of sense with different kind of levels of economy to go along with the cap, right? It has different kind of ceramic coating, steel coating, and so many things. And again, there are different kind of surgeries that are being available. So people can be recommended based on your profile, can be recommended with other patients, can be recommended to choose a specific kind of surgery. And we can also come out to say that the surgery will not be useful. It is not advisable to spend huge amount of surgery. Normally, doctors give us this advice, but we require that by validating the data, what is being generated with us, our own data. My own data should help me to associate and come out with a conclusion or to identify risk for medical complication, exact risk for my medical complication. So this is where evidence-based medicine it comes in. And as I already said, that clinical trials was not was very old earlier, but this pandemic has made what to understand as clinical trials. So clinical trials, it is identifying patient who really needs for the specific diseases such as chronic disease such as cancer, oncology, diabetes, and we need to test drugs only on those people. But now it is a trial and error medicine that has been given for different kind of things, neuro disorders, brain related diseases, and all the things. Because getting people who are affected with that kind of alignment and imposing the drug on that and do it. I think there are R&D laboratories and large hospitals. They do get the consent to the people suffering from the alignment, take the legal notification, and now the consent of the patient. They are being, when they give the consent format, they try to test the new drug onto the patient. This has been happening on consent. If it is under consent, there is no issues. And when I like to talk about Steve Jobs, we know because of Apple, Steve Jobs, who was suffered with cancer, he himself made to test with clinical trial drugs by using different kind of study. He himself became specimen to give out his vital samples, consume drugs so that it will be beneficial for the society. So this again is going to be a very good area so that in betterment of life for individuals can be carried out. And again, we say that, right, we need patients to take care, we need service providers to take care, we need old age people to take care. So we require mobile applications. Now I need IoT devices to take care of my old age people who are in my home, where I will be in my office. We need a patient care system. So we need wearable devices. So IoT comes into picture, say that they are good, they are moving out, they are all those things. So monitoring medical devices, what is the position of your wellness devices? So IoT comes in. So these comes under real-time analytics, and this can be automated. Artificial intelligence can be automated at a thinner level. And this is where it comes in. And in pharmacy, again, I said that, right, for internally identifying the pathway to come out with a specific gene target to come out with the chemical. So whenever we talk about pharma, then we could not leave chemistry because combination of chemicals is being used for your drug. So again, right, identifying that. So chem informatics again is an area where a lot of scope for artificial intelligence. Again, now we talk about nanoparticles, nanosensors, biosensors, which can be injected into humans, right, for their brain to help them or to help them. So in that case, we are identifying materials. So we could not leave out physics. We require nanoscientists to come out with their materials, maybe chips very thin line, and all those things. It has a lot of scope in biopharmaceuticals. And real time, I think I've shared you with more information. And pharma also, it is being shared the same slide in a different picture in a visual form. And again, this has been done. And roles of multiple disciplines. Now we need a mechanical engineering. So I need a mechanical engineer. Why do I need a mechanical engineer? So we look of biomedical devices, right? That has been come to help people. So when I want to have ortho, right? Ortho, right? When we have different orthopedics. So there are different kind of equipments being come up for people to move who are being suffering from long alignment. So we need a mechanical engineer, an electronics engineer to combine together to make up a device with the input of orthopedics, ortho surgeon or ortho experts, because they know the biomechanics, right? So where it will be flexible, where it will be plain. So mechanical engineering is an area which is related to life sciences. Chemical engineering is an area which is related to life sciences. And telemedicine has been coming up. So writing up the medicine, technology-based medicine, that is transferring the information to technologists, reading the so many things. We need automatic bots to assist the rural areas, help people to know what is their alignment, where to approach, how to approach. So all these things telemedicine can serve. And apart from that, we do also connect with the other layer of business, finance, process, insurance, economy, and all those things. So when we try to talk about life sciences, then we have different kind of people, different kind of domains, different kind of things connected together into it. And again, we have left animals. Again, animal study, veterinary science, all those things can be brought in. And I hope that that it is. And these are the roles. So this is where AI can pitch in. Now, what is the role I require when I want to get into data science pipeline, since it is multidisciplinary? So I am from bioinformatics. I am from a biological background. I belong to biotechnology. I belong to chemistry. I belong to botany. I belong to zoology. Where are my opportunities? There are opportunities in R&D laboratories, clinical laboratories, and pharmaceutical industries for analyzing the data. So what is the skill that has been required for these people? Extract data from the biological databases that are being available. So this is one skill. And to do that, what is the technical skill set that has been required? Can I avoid technology and make something to be done by itself? No. So human expertise, we need what is the skilling of people, students, graduates, manpower has to be created in these areas. So knowledge on programming languages such as SQL programming, R programming, and Python is essential, particularly to work with life sciences. And there are good data analytic tools available. So good tool is Excel and some other tools as and as pieces for commercial software, and big data tools and Hadoop and Spark not required for life science people. There are other tools available. Those tools can be used. So they use MATLAB and something for research. And what are the technical skills or domain knowledge skills? So when I take up a problem or when we take up a problem, then we should know some basic statistics to analyze my data. You know some basic mathematics to know what is my mathematical model. Then I should know some programming. Then we should know something called as logical thinking and natural language processing. NLP is dealing with the unstructured data. And finally, what is the domain knowledge required? It is, you should be a very good communicator. Communicator, not fluency in English and not fluency in any language. Trying to present what we have gathered from the data, map the business people, map the technologists, map the clinicians, and map the stakeholders, whoever might be. Map the stakeholders, whoever might be. So this is what is the domain knowledge we require. And these are the different kind of roles we have. So data scientist, entry position is PhD, any area of PhD, data engineer, this too technical for technical graduates of computer science and other. Data analysis, again, it is domain specific, bioinformatics, life science students, some good opportunities in pharmaceutical and R&D laboratories, and machine learning experts, again, a mix of things both can do. Data architect, who collects data. Data architect is a person who builds data, who collects data to make my problem addressable, and the business analyst who looks on how this data, what is being collected, can be converted, which part of my feature add value to my business. So it needs a business analyst also to pitch in. And domain knowledge, what I require, it is since we know that this is an area, or this is something that is being related to different multidisciplinary field is what is this is being concerned. So as I said you that when I talk healthcare, normally we do not have an interdisciplinary approach. So we do not think about something called as commerce and management. But when I look on with drug delivery, then I should have some knowledge on supply chain and logistics. How do I transform a drug to the pharma which is being located at Vadavalli at my place, or it is being located at somewhere at some place? So how do I make it to efficient and how fast? How do I ensure that the cost of human, the cost of manpower and the time of people is being not wasted, right? Pros and cons of amount is not being wasted. So we need domain knowledge, not only from computer science, not only from your area, but also requires domain knowledge from other relevant areas, because we have to connect with different kind of people, and our problem, it has different dimensions which can be collectively progressed to achieve one single solution. So this is what finally I've come up to the wrap up the sessions. So I would like to hear if you have any questions at this point of time, then I can answer your questions. You can post the questions in the chat. Okay, there were questions. Correlate the mutation with the severity of the phenotype. See, the question to correlate the mutation with severity of the phenotype, how to begin with. So it requires a core bioinformatics knowledge. So to correlate the mutation, first you have to identify the phenotype, right? So to identify the phenotype, again, we have to do a phylogenetic study to identify and do something. Then only we can try to map it and find it out, the severity. So severity is not only being caused in so many things. So when you look on with again with COVID, so they tested the drug, they find features in tiger, they find different kind of features in lion, animals affected in zoos, and so many things. So again it requires the correlation, scientific statistical features has to be looked at. See, artificial intelligence will not give you any data. The data we get from artificial intelligence is reliable when you assign causality to the novel mutation. Artificial intelligence will not generate any data. Whatever data we train to the model, only based on the input what we share, it is going to come out with a decision. But what it is, it will walk through with different kind of points of all the data points, and it can try to find out that. So artificial intelligence is the last layer of my data science process. And when I want to find out the novel mutation and causation, then you require a good feature engineering. You have to collect the data, what you would like to work on. Since you say about mutation, so mutation, what type of gene, what type of parameters of genetic study you try to integrate into it. So that has to be, that brings you the efficiency. And step to stall the build. See, algorithms as far as concerned, this is the question. Can you elaborate on the step to start to build algorithms to compare the mutation and classify and moderate is the question. There are tools available. There are built-in libraries available as far as bioinformatics is concerned, both in R as well as in Python. So you need not, or we will never build any algorithm from scratch, because all the machine learning algorithm and deep learning algorithm are being well devised by top organizations such as Google. Google's TensorFlow and Keras that is being used for machine learning and deep learning. So they have a well-defined mathematical model, and they have a very good structure in such a way that it can accommodate any kind of data. So once what we should know to do it is, we should know to we should have the knowledge of pipelining the data into the existing model so that it gives you the better result. And whatever data you push into the existing model, it will throw you the result. But the data what you provide in, it matters. The feature what you provide in, that it is going to give you the kind of accuracy and classification. So the classification accuracy and I think is a very, very, very easy thing that can be done. Already existing libraries that can be used. But one thing it is the data processing phase, gathering, feature engineering, and collecting different coherence of data, association of data. It is where the innovation and creativeness of data scientists holds or stands. So, do you have any other questions? If you do have any other questions, you can post it in the chat box, or you can unmute yourself and put up the questions. Hope there are no questions. So no questions. Then I think we can end up with the conclusion. So session wrap up with this what I started with the data science. So it has 3 phases. One is data pipelining, other one is your modeling phase, and another one is your evaluation phase. And when we look at with the technology stack of data science, it contributes to different kind of fields: data analytics, statistics, mathematics, natural language processing, databases, visualization, and programming languages. And we also moved on different kind of analytics with different kind of use cases and different kind of applications and data sources for healthcare study. And hope that this was been discussed in relating with artificial intelligence, And since there are no questions, I'd like to end up my session. So at this juncture, I would acknowledge the brand names and product names used in this contents. So which are trademarks or trade names of their respective holders. And I acknowledge all the contributors where I have used the content in one way or other. And I've used the content not as any direct slides. There are some slides which may be taken directly, as some images where I've given the references. So I acknowledge the contributors. And some content has been taken by listening to some videos and that it has been transformed in a different kind of scenario. So I would like to thank the acknowledgers for that. And I would like to thank all the participants and the organizers for giving me an opportunity, right, to share the knowledge, what is being gathered or what we are working on. Thank you all.
Thank you so much, ma'am. It was really very